कैसे हैं आप?
Hello, good afternoon, everybody. We are back with another webinar of the CxO Global Forum. My name is Noorulain Zafer, and I'll be moderating today's session. Extremely delighted that today we are covering a very important topic that the country has been talking about as well, and there's a lot of general talk, especially post-COVID, around digital health solutions and what it means specifically for countries across the globe. We went through a crunch period where the medical field had to innovate, go into interventions that were not unheard of, but we're still taking a slow starter on that. But with COVID-19 hitting the world and the global pandemic taking its toll on everybody, there was a general sense of urgency. There was a lot of transformation that did take place, and it took place also because there was a sense of urgency, from providing healthcare facilities to ensuring that there is sufficient relief measures that are put into place, from also ensuring that how do we do remote monitoring of patients, how do we provide telemedicine facilities. So today we are really delighted that we have a panel to discuss the digital health solutions for rural and remote areas in Pakistan. I am joined by some brands that you have heard about. You have heard about them talking about the wonderful work that they're doing on ground. But today's session, we would essentially want that it's a conversation between our viewers and our experts who are sitting here. So let me just do a quick round of introductions, and we'll also do a sound check along with it. Joining me today is Asim Alam, who's the founder of WebDoc. Assalamu alaikum, Asim. Thank you for joining us.
Thank you for inviting. Thank you.
Thank you. We are also joined by Dr. Tazeen Rizvi, who is the co-founder and CEO of xeven Health. Do we call it xeven?
Yeah, it is. Thank you very much. I'm happy to be here. Thank you.
Great. Thank you so much for taking out time. And also joining us today is Wasim Irshad, who's a co-founder of Wow Health. Wasim, assalamu alaikum.
जी वालेकुम, thank you जी, thank you so much.
Excellent. So with that, we just dive down into the conversation, and I want to put the first question to our panel members. Meanwhile, all of you who are joining us online, we are live on our Facebook, LinkedIn, and YouTube channel. So feel free to put in any comments. Anybody who's the health tech space wants to questions, just feel free to do so. Or if you're even eager about or working on an idea and you want to look into the possibility of scaling it up, then also please do reach out to us and look at this recording, which will be available later on as well. Diving into the conversation, lady and gentlemen, there has been a lot of talk, like I mentioned in my intro as well. Telemedicine की बहुत सारी बात होती है पाकिस्तान में. हम शायद उसका full potential अभी तक reach out नहीं कर सके. We have a population, we now not really have a fully rural population, urban rural, we should call it, but still the people who are living on ground, where we still, when we talk about access to better healthcare facilities, there is still a lot that was expected of the telemedicine. I just want to pose up a question to all of you. What are some of the challenges that you feel exist in a country like Pakistan? So many problems to solve. Solutions जो हैं वो थोड़ी कम हैं. Asim, I'd like you to take a first get-go on this. That when we talk about the healthcare sector and when we talk about the digital side of it, what are some of the challenges that we as the common public face?
So, right. Thank you very much, first of all, for inviting. I think there are two segments of Pakistani population. One, we can divide them in two segments. One is rural Pakistan, and the other one is urban Pakistan. And we can include those, semi-rural and semi-urban sort of to the rural and urban Pakistan. So जो रूरल पाकिस्तान है उसके पास सबसे बड़ा चैलेंज तो ये है कि पहले तो उसके पास स्मार्टफोन ही नहीं है, बहुत कम स्मार्टफोन, ओनली 67% पीपल डज नॉट हैव अ स्मार्टफोन इन द रूरल पाकिस्तान। अच्छा, फिर अगर स्मार्टफोन किसी के पास है तो क्या इंटरनेट की अवेलेबिलिटी है? दैट्स अनदर वेरी बिग चैलेंज। So that these are two challenges to the rural Pakistan. Then on the urban side, although there's an access to the doctors now, you have an access to internet, but obviously affordability remains one of the main factors on both sides. So I personally feel access to the internet, access to the healthcare, that is one major factor, and then obviously the affordability is another major factor. These are the two factors जो कि हेल्थ डिजिटल हेल्थ केयर को उस तरह हम लोग उसके पोटेंशियल को अभी तक रीच आउट नहीं कर पा रहे. फॉर एग्जांपल, टेक एन एग्जांपल ऑफ WebDoc. We are actually serving just touching 30 million customers in Pakistan. That's a huge number. That's about 12% of Pakistan. But still, there are 88% of Pakistan we are unable to actually, provide access to them to actually connect to the doctors. So that's and then again, this is, I'm talking about more of an online doctor than the digital doctors really, because the internet availability becomes one of the major factors. And if there is an internet, then obviously affordability becomes the factor. So I think these are the two major factors जिसकी वजह से डिजिटल हेल्थ केयर उस तरह अभी तक बूम नहीं कर सकी. However, I can safely say, but not only we are working this field, many other companies are also there. So हम तकरीबन 30 million customers rural को services provide कर रहे हैं, and I'm sure other companies are also providing services. So we are still covering 12-13%. So it's a big space still empty. They won't to the doctors. They won't access to doctors. We can't really do. This is one of the major factors, really.
Great. No, makes perfect sense when we talk about the mobile usage also, and the number of users that you're talking about. Still, the pie size is too huge for it to cover the population, the target population that we're looking at. Wasim, I'll come round to you, and then I'll move on to Tazeen to get a global perspective on it. With this particular thing, revolves a lot of regulatory work that needs to be done on ground. There's a lot of, we do see that there's a fair amount of competition. The competition in the telecom side of things has also made, budget-friendly plans where people are still now using smartphones. But do you think that the regulatory framework of the country still has a lot of appetite where they can encourage ed tech to come forward and just be more be the key player in solving these problems that people have on ground?
Yeah, I think you're very right. We don't have any proper legal mechanism for to legalize telemedicine and related things in Pakistan. अगर आप बात करें तो still we Health Alliance has done something. We have got a draft over there. कुछ बातें हुई हैं, ठीक है. Still कई दफा I face this question all the time कि यार क्या legal standing क्या है इसकी, and legal standing actually brings the trust. तो मैं इस क्वेश्चन को थोड़ा सा कनेक्ट भी करूंगा आसिम साहब के क्वेश्चन जो उन्होंने आंसर दिया, जो दो उन्होंने फैक्टर्स बताए, वेरी इंपॉर्टेंट फैक्टर, एंड आई वांट टू ऐड टू मोर फैक्टर्स टू इट. दैट इज वन ऑफ देम इज अडॉप्शन एंड ट्रस्ट. एक्चुअली पेशेंट जो है, आवर पेशेंट्स हैव ऑलवेज फेल्ट टू टॉक टू डॉक्टर इन पर्सन. डॉक्टर इंजेक्शन लगाता है, डॉक्टर थर्मामीटर स्टेथोस्कोप से चेक करता है, एंड दैट्स हाउ हमारा कंप्लीट मैक्सिमम जो रूरल एरियाज हैं वो डॉक्टर को उन्होंने हमेशा परसीव ही ऐसे किया है. When you tell them that there's a way where you can talk to a doctor over the phone or you can talk to a doctor over the video, they can't apprehend it, right? And this adoption, if we can increase this adoption, we all together, we have to work together so that we can increase this adoption. If we increase this adoption, we can bridge this whole gap between doctors, decreasing number of doctors plus increasing population. We can bridge it. इसमें एक और जो बहुत इंपॉर्टेंट चीज है, दैट इज ट्राई वंस. आसिम साहब इस बात से बड़ा एग्री करेंगे कि द पीपल हु ट्राई द सर्विस ऑनलाइन, दे टॉक टू द डॉक्टर, और उनको जो है अच्छा फॉलोअप मिलता है और डॉक्टर बड़े प्यार से बात करता है और उनको मेडिसिन से जो है दे गेट ओके, तो उनका ट्रस्ट बिल्ड हो जाता है. देन दे टेल टू समवन, या वो या उनका कोई रिलेटिव, देन दे कॉल बैक अगेन. सो वो हमारा रिपीटिंग कस्टमर बन जाता है, राइट? This is how word spreads. But people should try it once. हम लोग अपने domain में we have launched a Polydog card which is available on the pharmacies, and in rural areas people can go buy it, keep in their pocket, so they have a tangible thing in their pocket. They take it out, they scratch it, they call to the doctors and talk to them. So our mission is only one, that if they get hold of this for once, they try it for once, then they are they can be benefited from whole system. And our legislative system has to help us out in this thing, to spread this thing, because government has to realize this thing, कि number of doctors और population, इसके दरमियान जो गैप है, दिस इज एवर इंक्रीजिंग. अगर आप जितने डॉक्टर प्रोड्यूस कर रहे हैं उसमें से माइनस कर लें वो डॉक्टर्स जो कि कंट्री से बाहर मूव आउट हो जाते हैं, और उसमें से माइनस कर दें फीमेल डॉक्टर्स हु आर नॉट प्रैक्टिसिंग, तो आपके जो नंबर ऑफ डॉक्टर्स रह जाते हैं उनके दरमियान और जो पॉपुलेशन है, इसका गैप इज ऑलवेज इंक्रीजिंग. So these two lines are never going to intersect at any point. So you need to
Sure.
have a bridging solution, and we need government support. अभी तक जितना भी काम हो रहा है ये सारा टेलीकॉम सेक्टर की सपोर्ट की वजह से हो रहा है, राइट? और
Yeah.
जितनी पेनिट्रेशन मिल रही है उनकी वजह से मिल रही है. बट इफ वी गेट मोर सपोर्ट फ्रॉम द गवर्नमेंट, आई थिंक वी कैन डू मच बेटर जॉब.
No, and rightly so. And I picked up two things which I want Tazeen you to focus on. We spoke about greater adoption. We spoke about Wasim also spoke about creating this general sense of trust amongst people who have to get these facilities. Now, in Pakistan, the situation is like too widespread. We have different levels of also identifying and checking up with the authenticity of a doctor. We also need to, we were also fighting. I think if we look at the structure, the sector in general, we're also looking at the rural areas, the sub-rural areas also have this concept of dispensaries and local, dispensaries where you would see nurses or perhaps lady health workers is setting up their own things. Now, equating that and putting up the value against a certified doctor that has also, gone through the process of verification. How is the trust or the greater adoption different internationally, and what are some of the best practices that the Pakistani startups can think about, replicating here?
Thank you, Noorulain. I will take it in steps. So, first, you said, how is technology adoption and trust different globally than in Pakistan as we compared? I don't think when we talk about trust, trust is a very human emotion. Yes, it does change a little based on the cultural context of where you are, but I think trust in a doctor is kind of the same that a person would feel when they are in Pakistan or they're anywhere else in the world. Or technology adoption, the challenges that we see in technology adoption globally, some of them are present in Pakistan as well, and some are some extra added because of the gap that Wasim said, as Asim said about affordability. So if you talk about major challenges, yes, cost is one, yes, trust is one, data security is one. I think in globally, interoperability is one. There's no lack of um, there's no seamless talking of two systems together. And you go to one doctor, they take your history, then you go to another doctor, they take your history all over again. This is not a great patient experience for the people who are already in pain and they want to repeat what they've been going through for the last, let's say, a year or two. So interoperability needs to be better. And one thing, and adoption of course is the key, but I want to point out one thing and add to what Asim and Wasim said, not only in the context of Pakistan, but in a global context, is digital health literacy. Digital health literacy is something that will increase your adoption and will empower your doctors and empower your patient population to take up digital tools to manage their health. And under this, I would say we need to teach not only patients, and as Wasim said, there is this culture thing. Or once we go to a doctor and they touch us, and they hold our hand to take our pulse, that's when we realize, what, we really were seen by a real doctor. This is a cultural shift. I think a lot was pushed by COVID. We are actually in the right momentum. It just needs to carry on like this. As Wasim said, a good word, a word of mouth, you try it once and you see. But if we improve digital health literacy overall, of the doctors as well and of the patients, it really ties in with better adoption, better access to patients living in rural areas. And that's where I also advocate a lot. Also, was not part of your question, but one of the things that the West is now doing, and something that Pakistan should do, and I know that we are looking into, is incorporating digital literacy into medical schools. Now, when you talk about telemedicine, talking to somebody like this virtually, like we are talking, it's a skill. When we're in med school, we're not taught these soft skills. We're not. So I don't know, and we can't just assume that today I was seeing a doctor in a clinic, and tomorrow, Noorulain, you ask me, Tazeen, can you come on a Zoom call? I want to tell you how I feel so you can diagnose me. I am going to be in an unknown territory because I was never taught how to use telemedicine to give effective treatment. So once the doctors are trained better, they will empower patients more, and overall we will see an increase in adoption globally and in Pakistan.
I think that's a wonderful perspective. I think this opens up another stream of advocacy and creating advocacy around the fact that there should be more digital literacy. Tazeen, I want to put this question to you now first because you went last on the previous one.
Sure.
There's a lot of confusion, I believe. I interact with a lot of startups in Pakistan, ideation phase, acceleration phase, and I feel that there's a lot that we look up to, but that when we talk about the health services, when we talk about health tech, वो सबके दिमाग में सिर्फ यही आता है कि टेलीमेडिसिन. एक स्टार्टअप, एक अच्छी कहानी, one startup, raising a round of funding, doing fantastic work, catering to a niche audience as stakeholders. सबका दिल करता है कि वो ये काम कर ले. I think one part of the advocacy is that people also understand that what avenues also classify as digital health services. I was listening to this a person from sub-Saharan Africa telling us about how they went into remote patient monitoring, and they were able to just entirely set up a connection between the caregivers who were at home, who couldn't come to the hospital, and connecting and creating that kind of empathetic models where people could speak. What other avenues, Tazeen, in your idea that could be perhaps like a brainstorming sounding board for any startup ideas to work on?
Okay, so when working in the health tech space, and I'm sure Asim and Wasim can add to it as well, Noorulain, you always need a starting point, right? So I think telemedicine is a good starting point, especially in a culture where we're not used to seeing a doctor online, right? Or we were forced to do so during COVID. So I think all the startups that are looking at giving virtual care, be it in the form of telemedicine or be it in the form of a phone call, as Wasim was saying about the scratch card, we need to actually, create a wedge that, okay, talk to me on the phone, talk to me on telemedicine, then we'll move to remote patient monitoring. So there are many aspects to digital technology. Or we're talking about remote patient monitoring, we're talking about robotics, AI chatbots. Look what chat GPT has done. I mean, created this wave of, now people are saying, oh my God, what's the future? So the possibilities are endless with digital technology. But there's always, I think telemedicine a good starting point, but I would say remote monitoring, secure remote monitoring. I think for you to be able to build that trust in a patient, that they wear a device and they are okay that their device sends information to you, that's a trust you have to build. Then you have to ensure there are policies of data security, whose data it is. Another big conversation in Pakistan, if I'm wearing a watch, it is my data. If I send it to another doctor, it becomes his data. So but medical education, technology in medical education, augmented reality, virtual realities, people are using metaverse for training and education. Now we are using pain management. There are a lot of research, and I think they're already been approved now. We're using augmented reality to reduce pain in terminal cancer patients. So there are so many possibilities, and possibilities that data gives you. So why digital technology is good in any business, and especially in healthcare, is because it gives you the data that you can build on, the data that AI can build on, the data that on which you can build medical algorithms. And all of that data then gives you solutions to provide better population health, better demographic health. So there are a lot of avenues that technology can do. But telemedicine is definitely, I would say, in Pakistan, the first step, because it's just creating a new culture of seeing a doctor.
Excellent. Asim, would you like to add on to the list that Tazeen has shared?
Yes, definitely, I'll add few things, but I think she actually explained it very well. However, in Pakistan, when we come in the local market, localization, that's totally different. Pakistan's population is less literate as compared to the global market. Economic crisis we are all going through in Pakistan. I personally believe पाकिस्तान में पहला स्टेप जो हमने लिया that is basically doctors on the call. When I started about 6 years ago, that was the first step, was actually bring people on the call and let them know that these are actually doctors sitting on the other side of the phone. So this was one of the hardest bit we've done in 2017 when there was no COVID. I mean, obviously nobody was forced to actually go online or over the phone. It was one of the hardest bit. We started telling people, and this is where we started using telco's brand. The reason, it was an access for the people, and then there was a trust element telcos provide to the customers, that they're very actually authentic people sitting on कोई दूसरे agents नहीं बैठे हुए. That was the hardest bit. Now the population is so big, the economic issues are there, right? So people won't be able to afford things. I mean, imagine when we talk about the rural areas, we have in 2016, 2017, we've been in the market, we've been on the ground really doing our stuff. Imagine कि आज भी सिंध के अंदर, you'll be surprised to know this, आज भी सिंध के अंदर there are areas जहाँ पे लोग सबज लगाते हैं, right? So what is सबज टीके? I mean, obviously हमने ये सुना था, जब मैं स्टार्ट कर रहा था, I've heard about सबज टीके, and we actually went down there and we saw कि वो सबज टीके हैं क्या. Imagine जो, how should I explain this lie, but I'll just go on because this is an education for the people, I believe. So जो गोबर का सख्त वाला हिस्सा है, उसको पानी में डाल के उसके इंजेक्शन फिल करके लोगों को लग रहे हैं, people are standing in the queues to get this. Imagine this is the sort of literate people we are talking about. और वो उससे ठीक होते हैं because they feel कि इससे ठीक हो जाएंगे. And there are number of hakims and doctors, so-called doctors sitting in the areas like this, जो कि millions of लोगों को ये काम कर रहे हैं. उन लोगों को convert करना on a digital technology is a very tough work as compared to somebody sitting in London or somebody sitting in New York, and maybe somebody sitting in a Dewsbury, a very small town of Yorkshire. वहाँ के लोग literate हैं, they know what is digital technology, they know everything is going to be according to the law. Over here in Pakistan, it's totally different. So I think this is a very, very good step that we are bringing people on the phone. We are telling them, there are actually doctors, GPs sitting over the phone who can actually help you through DD. They can, initially give you some sort of advice or a direction where you can go, and then this is your first step. And then we'll bring up, we are now in the phase of bringing apps for them. So, app ke upar aake aap doctor se baat kare. Now you can share your documents. Now you can share your MI reports or X-ray reports. Doctors can actually reply on this. I think abhi waqt lagega. Before in Pakistan, in the local environment, we can go on to AI or Chat GPT or many other tools for this market. Yes, maybe urban market will cover it soon in next 5 to 10 years, but at least start covering it in 5 to 10 years. But rural market, there's a big difference. We have to make those people literate first, bring them on the digital technologies. They start using Facebooks and TikToks now. Now they know there is there could be another person sitting on the phone who is actually Dr. Tazeen Rizvi, right? From UK or from America or from Islamabad, a brigadier sitting on the phone serving a customer and thata. So this is now happening. I think it's a good start for Pakistan. Long way to go, but challenges are there. Challenges are लोगों को literacy नहीं है, challenges are affordability नहीं है. ये बहुत बड़ा concern है. बहुत बड़ा concern है कि किसी के पास 2000 रुपए ही नहीं है कि वो actually किसी डॉक्टर की फी दे सके. That's a massive concern. अर्बन एरियाज के अंदर मैं आप सब लोग अफोर्ड कर सकते हैं इस चीज को. इमेजिन जिसके पास एक्चुअली 1000 रुपए है, जिसमें से उसने 990 रुपए अपने खाने पे लगाने हैं, और ही इज लेस बॉदर्ड अबाउट हिज ओन हेल्थ. तो उससे 1 रुपया 2 रुपया लेके हम उनको उस तरफ लाने की कोशिश करें. दैट्स ऑल वी आर ट्राइंग टू डू फॉर द टाइम बिंग. और वंस वो इस सिस्टम पे आ जाएगा, अंडरस्टैंड कर लेगा कि व्हाट इज टेक्नोलॉजी, व्हाई हाउ कैन Dr. Wasim or Dr. Noorulain or what, Dr. Fly sitting on the other side of the phone, they can actually मुझे देख के मेरी तबीयत के बारे में सही प्रिस्क्रिप्शन दे सकते हैं. And this is where probably apps will come into play, and then somehow we'll find a way how to pay less to the doctor, and this is where I believe this can scale. ये मेरा ख्याल है.
Thank you so much, Asim. And I think very valid observation. And I think one of the things, just on a lighter note, that I like to mention is much better consulting Google for a headache that you're having than going to an actual doctor who is advising you कि आपका blood pressure भी हो सकता है, आपकी eyesight भी खराब हो सकती है. वो Google तो आपको सारा बता देता है कि बस अब आप बहुत ही करीब हैं, आपका आखिरी वक्त जो है वो बहुत ज़्यादा करीब है. And I think we need to curb that practice, and especially in terms of finding the right kind of information. Wasim, since we have spent some time, I want to pose a different question to you. I am aware of time, but we still have 10-15 minutes that we should take this session for. Every sector that we take in Pakistan, चाहे एजुकेशन का हो जाए, चाहे हम उसमें ऑयल एक्सप्लोरेशन की बात कर लें, चाहे हम एग्री की बात कर लें, चाहे हम हेल्थ की बात कर लें, there is always a discussion that is coming predominantly in all of the panel discussions, whatever I'm seeing, whatever you are seeing, whatever we are a part of, that there's a general lack of R&D in the country. इतनी रिसर्च हमारी ख़राब है, इतनी हमने सैम्पल साइजेस पे काम नहीं किया हुआ. ऑल दैट वी आर स्पीकिंग अबाउट, ऑल दैट आई हेयर यू गाइस स्पीक अबाउट इज़ वेरी मच the first principle of a human centric design thinking approach, where you go down to the level of people, you take empathy of their problems and you understand. जितना हम unstructured बात करते हैं, मुझे सिर्फ आप ये बताएं कि R&D अगर कोई स्टार्टअप करना चाहे, अगर कोई बिजनेस करना चाहे, आप लोग you're a part of established businesses, you've been running your ventures for the last 6, 7, 8, 9, 10 years. How frequently should anybody be engaging in R&D? Should it be regulated by a public sector organization? Should we just go ahead and do it? How important, when we're speaking about the rural side, when we're talking about the rural areas, rural population, कितना important है कि हम कोई sample size लें और उनसे जाके कोई सवालात करें, and how do we extrapolate that data into information?
That is so interesting and important question. अगर आप देखें, देर इज एकेडेमिया जहाँ पे रिसर्च होती है, एंड देर इज इंडस्ट्री जहाँ पे प्रैक्टिस होती है. वी गाइज वी डील विद द पीपल एवरी डे इन आवर बिजनेसेस. We try to use whatever data we have, whatever apps and technology and everything, so that we can make people's life easy. But then there is academia. Their job is to do research to find out the ways how patient can be served in a better way. And this research should be localized to the that geography, because पाकिस्तान के मसले अलग हैं, यूएस के मसले अलग हैं, यूके के मसले अलग हैं. We are still financially we are not that strong, and हमारे लोगों की affordability का बहुत सारा issue है. That even if we can come up with ways where we can reduce the price and increase the accuracy and prevention kind of thing, that can be much better. So I was working, if you just go into universities labs are doing research to publish papers, just you know and government has no way to support them properly, so that their ideas, their research that has been presented on the reasonable forums can be transformed into a product, right? So I'm working with lots of startups. One of the startup is, they are from fast, and they are working on the cancer detection on the biopsy slides. And these guys have one of the wonderful algorithms, one of the competing algorithms in the world. They are presented in it in international forums and have been awarded amazingly great. But what to do now? These are not business people, these are not industrial people. They don't know how to market it, how to sell it, how to reach to the, to the market, how to benefit people, they always, keep coming. The CEO, one of the startup CEO, she's a lady. She has a kid of like, 1.5 year. She carries the kid along, from long way, and come to me to discuss कि हम लोगों ने ये बना लिया है और हम लोग इतनी जगह प्रेजेंट कर चुके हैं और इतने पब्लिश हो चुके हैं, लेकिन वी डोंट नो व्हाट टू डू अबाउट इट. ठीक है, we don't have a way where we can sustain it, because these guys will do research, they will publish it, and then, there is no sustenance in it until either any bigger organization start, feeding money into it, or this is transformed into a product by some advisory board like Asim Saab, like Dr. Tazeen, and the government people, and they are given a platform where they can go and, you make this product work. This has got a lot of potential. I have internationally worked with the doctors. Every lab has got huge budget, and they are associated with one of the leading companies in that sector, and this company owns it either and invest money in the product so that this can be made sellable. That's so important question, I would say, कि इसके ऊपर काम करने के लिए, I think, what generally we, me, Asim Saab, Dr. Azeen, Dr. Saira, and everyone in this industry, when we are doing business, we are earning something, we should put something aside, go into the labs, find out the right ideas where we want, which are strategically aligned with our business goals, pick them up, support them so that they can be transformed into the products that will help uplift whole industry and whole, value chain.
Yeah, I just want to add
I,
something.
I, I,
Sorry, Noorulain.
yeah, yeah, please,
Yeah.
please. No,
So
go ahead, go ahead.
I think the best, if startups are looking and if people are listening and they want to know the idea, it's very simple. Go to the ground, talk to the patients. The best idea would always come from the user. And the smallest pain point, I always say, and I talk to so many health tech entrepreneurs, and I always tell them, pick one problem, pick one pain point of a patient, develop something that addresses that pain point. Don't think, don't create, oh my God, I'm going to create the best mobile app in the world. It will do telemedicine, remote patient monitoring, personalized medications, real time alerts. No, take one, just one pain point of a patient. Once you solve that one pain point with a good functioning, easy to use mobile app or a web based app, then move on to the next one. Sometimes the solutions to big problems are very small. Their solutions don't have to be really complex. Healthcare in itself is so complex. Take one small pain point of a patient and then just work backwards from it towards it. How will I solve this? Once you've solved it, people are using it, you're making a difference, then you move on to the next big thing. So I think it's just one pain
Excellent.
point.
Yeah, no, no, and I completely agree with all that you're saying, and Tazeen, this also correlates with the fact that you were saying that we need to teach this at the academia level. We need to inculcate courses and just develop this constant, a continuous professional development where professionals tend to go and venture not into like horizontal courses and degrees. वो चाहते हैं कि वो horizontally अपनी growth करते रहें, but venture out and see what other verticals can you go into, and all that you are
Absolutely.
talking about. We're talking about AI, we're talking about venturing out into startups. This made me from what Asim you said, it just made me recall that I was studying a study, and it spoke about the 20 best startups in 2021 in terms of product innovation, and also just correlating it with the monetary value that they had. And Fuji Films, the old कैमरे में जो डलती थी फिल्म्स, दे एक्चुअली reinvented that process. वो कैमरा तो खत्म हो गए, डिजिटल पे सारा कुछ चला गया. They use that same magnetic film to actually put up into an MRI screening system. And they said that the technology still remains the same, but reworking a vertical, reworking business idea and going into a different vertical aligning it with the pace of the world is something that we're looking at. And to me, that was a study that was really nice, because somebody who's grown up in the 90s, we understand the concept of those cameras. Technology अच्छी है,
True.
but उसकी embrace अगर नहीं होगा तो नहीं होगा. One final comment from all of you. And I keep asking this, and all of the positive things that you are saying is just making a lot of sense. What kind of any kind of you feel that policy recommendations that we can give? I know, Wasim, you spoke about the legal status. थोड़ी सी हमारे पास social entrepreneurship की एक category आ रही है for social entrepreneurs, but what other policy recommendations can you guys just chip in for regulators, so that if we take this to a regulator using the CxO Global Forum as a platform, and if you want to put in some set of recommendations, what should they be? Tazeen, you can go first.
I think, yeah, I think probably I'm going to expand, Noorulain. I think we talk a lot about legal structures of data security, structures of interoperability, digital governance, and, but that's all great. But are we there yet in Pakistan? I don't think so. And I completely agree with Asim. जहाँ पे हम एक डॉक्टर को देखने के लिए पैसे जमा नहीं कर सकते, हम इतनी बड़े बड़े सिस्टम में इन्वेस्ट करें इस वक्त या नहीं, आई थिंक. And building on to what Wasim said, invest in education, invest in digital literacy. And I think the time is right now, because a lot of our population, everybody's on TikTok. I think everybody wants to use TikTok and even knows how to use TikTok. Believe me, if you give me TikTok, I would be lost. I've never used it, but people churn out videos within seconds. Now, this is how you are looking at a generation. Mind you, Pakistan has a young generation. You've got most of your people are young. So if those young people are using TikTok, then why can't we teach them to use other digital tools to see a doctor, not for themselves, for their aging parents, for their grandparents, become carers, use the same technology for fun, but use the same technology, for seeing a doctor, mental health support, another thing that is so, so important, but absolutely non-existing in our country. And I think digital technology gives a really good angle to mental health, that you can actually talk to a therapist while you're sitting in your home. Nobody needs to know you were talking to a therapist. Nobody sees you in a therapist clinic. So I think invest in digital literacy, invest in education, invest in medical colleges to churn out doctors that can think that, oh, you know what, I can use this technology to improve my patient's health,
Yeah.
and
Yeah.
invest in research. That I think I would like to recommend. Yeah.
Excellent, Tazeen. Asim?
Right. वैसे तो मैं आपको बताऊं कि I'm not really a good speaker about the policies and regulations and stuff. I've been a sales guy most of my life. I know the business models, how it works. However, I completely agree with Tazeen here. Pakistan is far away from these things. I mean, यहाँ पे तो government की priorities में health तो है ही नहीं, और मुझे नहीं लगता कि अगले 10 साल में होगी भी. The reason being, यहाँ पे government की priorities में अभी financially stable होना है. This is the main problem we have for the time being. Next for few years, yes, yes, I completely agree. If we literate our people from the bases where we are creating the new doctors from those schools जहाँ से लोग पढ़ के आते हैं, they know exactly how to use the technology. I mean, I can give you a quick example on this. Sorry, I know we're short of time. So when we hired the doctors in our initial phase, nobody knew कि हमने लोगों से पूछना कैसे. So only few doctors knew कि कैसे करना, and we didn't know at all. I mean, it was nothing was happening in the world on these baselines. Only Africa was one country जहाँ पे शायद ऐसे मॉडल्स यूज हो रहे थे जिसको हमने फॉलो करके we started building that DD. And some of the intelligent doctors came up, उन्होंने बताया कि क्या होना चाहिए. And we've been telling the government ever since. I remember how many times I've been to PM and DC that whether WebDoc exists in your books. Who are we? I mean, if I'm serving somebody, what will happen to me? कुछ किसी पेशेंट को कुछ हो गया तो what securities do I have? I've got 30 million customers. मुझे नहीं पता कि मेरे डॉक्टर्स किस कस्टमर को क्या सर्विस दे रहे हैं. So कुछ regulations हैं, nothing, there's nothing. So there is a DHA, Dr. Aswar ने एक step लिया, and all these 5 people came up to build this DHA, but that's a private association we built. I have nothing to do with the government. People do come there, for the fancy flags, but होता क्या है उससे? Nothing. This is why probably Tazeen haven't seen me anywhere. I'll rather concentrate more on the business than in the events, because I know the end results. Unfortunately, is government is not going to step in, which is very bad. So this is all my complaints to the government. They can on the policy side, yes, we need to have a structured regulation. We have to have initial education for all the people, including the youngsters who are using TikToks and stuff. I'm not very good on this, so I'll
No,
pass on.
no, but I'm actually taking a very positive note out of this, because what you're saying about business and having a business model that is working and focusing on sales is essentially what we need to do to encourage more startups to intervene. आप पैसे नहीं कमाएंगे as a social enterprise, तो आप कैसे grow करेंगे? That is my
Yes,
concern. There is one thing that you need to do in terms of philanthropy, but there's a completely different thing when you talk about social entrepreneurship and taking it as a business model and focusing on sales. So Asim, I definitely take that as very positive feedback. Wasim, over to you for the last comment. Any recommendations that you think?
ये एक्चुअली अगर आप हॉस्पिटल्स की बात करें पाकिस्तान के अंदर स्पेसिफिकली, अगर आप टिम्स को देखें, लेट्स सपोज इट इज टेकिंग लोड ऑफ कश्मीर से लेकर इस्लामाबाद तक और बालाकोट से लेकर इस्लामाबाद तक, अगर आप चले जाएं वहां पे तो यू विल बी इन अ क्यू ऑफ लाइक 2000 पीपल. भले इट्स फ्री, but people they are just laying on the floors. So these hospitals do not have capacity to serve these many patients. Now if you just Dr. Azim will agree to this thing, that 60% of the diseases are very small diseases, and they are solvable over the video or phone.
True.
Now, if government bridges, this thing, with the telemedicine companies, and keep them as a doorkeeper for anybody who comes to hospital,
Yeah.
first he should go to telemedicine company. If he do not gets okay, then he can come to this hospital.
Yeah.
Now,
Triaging,
automatically,
Wasim. Yeah.
yeah,
Triaging in the
yeah,
hospitals with
exactly. You
telemedicine. Yeah.
you you cut off the load to half. How will people will go to telemedicine companies? I have cough, I have flu, I have pain in my continuous pain in my head, or something. These all problems are solvable over the phone. We have got systems where people can get tests done, they can share reports with us, we can prescribe medicines to them, they'll be okay. अगर आप देखें satisfaction rate, अगर आप आसिम साहब से पूछे तो it must be very good, plus 90% plus, because that's what we are getting. So why do everybody has to run to hospital, create rush on the roads, waste their own time, get in the queue?
Money, waste
Yeah,
their
and money
money.
and everything. Why not? So government should think about on these lines, that they have got less doctors, so they should create telemedicine health experience centers. We did these telemedicine companies, and
Excellent.
then they can move on from there.
Thank you so much, boss, Wasim, and I'll like to add something to it while you were speaking. In addition to money, in addition to wasting their time, their resources, we're also looking at a wider area, a wider population set, and just thinking about inclusion. I want to close on a story. So to all the viewers who are watching us, I was doing this particular training workshop with women entrepreneurs in the Gilgit Baltistan region, and one of the ladies actually was a lady health worker for the last 15-20 years, is running a small clinic, right? And she's saying that a woman who has to seek some kind of counseling, which is postnatal, has to travel 40 kilometers, and this is the only clinic in that region that is addressing women, right? Both as the prenatal and the postnatal levels. This is what we're talking about. This was the whole crux of
Exactly.
today's discussion as well. Yes, Vaseem.
I was in Swat, and people told me that first gynecologist sits in Kalam. Kalam and Swat are so far distant.
True.
And Mengora, sorry. I was in
Absolutely,
Kalam. I was in
absolutely. Yeah.
Kalam, and first category sits in Mengora. So it's,
Yes.
can you see, imagine the distance?
Roughly
So,
four and a half,
telemedicine
five
can
hours.
bridge
Yeah.
it, and
And Wasim, you raised a very good point earlier. So we've got a lot of female population that's sitting at home, जो घर से बाहर नहीं निकलना चाहती because उनके बच्चे छोटे हैं और उनकी जो भी personal limitations or challenges हैं. Now
Yeah.
you have a pool here that are doctors,
Hmm.
doctors graduated, very competent doctors, but not working. And then you've got this female population that has no access to female doctors. The solution is very simple,
Yeah.
actually. आपको कोई बहुत ज्यादा फैंसी ऐप नहीं बनानी.
नहीं
आपको
बनानी.
या आपको सम अगेन छोटे छोटे मसलों के जल्दी छोटे और ऐसे सॉल्यूशंस निकालें जो इतने एक्सपेंसिव ना हो. सो कम से कम थोड़े रास्ते खुलें, you know,
Yeah.
let for more complicated technologies to come. Yeah.
Yeah. No, so
Just,
yeah.
I'm
Yes,
sorry.
please go ahead. I'm loving that nobody
Yeah,
wants to end the webinar. I'm loving this conversation. Please.
I just want to quickly add something in it. So जब मैं कहता हूँ ना localization, that's very important. So few months ago, we started feedback calls to the customer. For example, we do receive about 20,000 calls a day. Sometimes it goes really high, but 20,000 plus calls a day we receive from the customer. So I thought we got a time, बीच में एक patch ऐसा आया था. We thought we should call back the customers and find out कि हमने जो medicine दी थी हुआ क्या उसका. I mean, did you actually took it? If you took it, whether कोई फर्क पड़ा कि नहीं पड़ा. So imagine I started receiving complaints from the people, and especially from the women. And they were complaining, why you actually given us a call back? Why there was a feedback call? Reason being, their husbands, their parents started beating them up. That did you actually call the doctor to speak to the doctor? And we received a call for a feedback. I mean, this is the problem with our community is that आज भी आप शहरों को निकाल दें तो गांव की औरत अपने प्रॉब्लम के लिए एक लेडी डॉक्टर को फोन नहीं कर सकती बिकॉज अगर वो लेडी डॉक्टर को फोन करती है तो ये उनके लिए अजाब बन जाता है वी आई हैड hundreds of calls and I had to put down this feedback system. उसकी रीजन सिर्फ ये थी कि the ladies were beaten to hell just for the reason that they've actually given a call to a lady doctor at the side. So parents and their husbands and their community, they were not pleasant with this. I mean, उनकी wife की उनकी बहन को कोई डॉक्टर लेडी डॉक्टर चेक कर रही है ये उनसे बर्दाश्त नहीं हो रहा था. This is again the mindset,
Yeah,
people
and,
still
and I
believe.
guess we don't even have, I think हमारी बहुत सारी population में, I don't think women doesn't even have a phone. अगर बात करनी है, so the husband would have a phone, or a male child will have a phone, right?
So
Yeah, I
what we
mean,
have done is we have recently launched our first video teleclinic, and it's going amazing. And our plan is to replicate it into rural areas. It's beautiful clinic, but doctor has not to travel all along. Doctors are here. They can speak to over the video. They can talk to the patients, especially females. We've got female doctors for those clinics, so that females can talk and they get the printed prescription right there. They can take to the pharmacy and get medicines, right? So we are trying to, everybody, every one of us and all of the fellows, we are trying to bridge some chip in something that we can do. But of course, there's a lot more to be done.
absolutely. I think every drop in the ocean counts, and we've discussed a lot of things. But just closing on this, that there's greater advocacy that needs to be done. There's greater research that can be done on this particular area. There are so many problems that we can solve. I agree with Tazeen that just aim for the low-hanging fruit, the quickest possible result-bearing action in term that you can be a part of. Thank you so much, Wasim from Wow Health, Asim from WebDoc, and Dr. Tazeen from xeven for taking out time and doing this very, very informative. I think this has been one of our most candid webinars that we have done. We have dissected this digital health tech industry as well. Lots of ideas that have come around. We hope and pray that you'd keep supporting the CxO Global Forum as well in terms of, writing more case studies, just talking more, just creating advocacy on every possible level that we can. Thank you so much, everybody, for taking our time. Till we see you again. Bye-bye.
Thank you.
Thank you. Madafis.